Assalamualaikum warahmatullahi wabarakatuh and very good day to everyone. I am Zul presenting the effect of palm oil derived tocotrienol-rich fraction on angiogenesis-related gene expression in streptozotocin-induced diabetic retinopathy in rats. I bet everybody knows about diabetes. This pathologic condition has been up to 422 million adults that have diabetes. This phenomena is characterized when there is very low insulin amount or very low sensitivity toward insulin, which correspond to type 1 and type 2 respectively. There can be a lot of consequences or complications as a result of diabetes, especially in cardiovascular, neurologic, and urinary system. But diabetes can also provide major impact in the eye by diabetic retinopathy or DR, which is the commonest microvascular complication of DM. So in global, 35% of diabetic patients develop DR and 10% has vision-threatening problem. This epidemiology is the same as in Malaysia. It is expected to increase from time to time. In general, there are biochemical and metabolic abnormalities that happens in the eye, which include oxidative stress, inflammation, apoptosis, and angiogenesis. So, for this presentation, I'm going to focus on angiogenesis. From this event, it can result in impaired vision and even blindness. From the hyperglycemic condition in diabetes, it can trigger polyol pathway, advanced glycation end product or AGE pathway, and protein kinase C pathway. And this can further cause oxidative stress, which is the imbalance between pro and antioxidant. From the oxidative stress, it will produce VEGF, and this VEGF cause ischemia and hypoxia. This phenomena will trigger more activation of VEGF responses, and with the help of IGF-1, it will produce excess of angiogenesis and non-competent vessel that further develop or contribute to the diabetic retinopathy. This is the structure of normal versus diabetic retina. The current treatment focuses on laser coagulation, anti-VEGF, and vitrectomy. However, they are invasive given at later stage and they have suboptimal outcome. Thus, we have proposed to use other medical alternatives for this issue. We have proposed to use tocotrienol-rich fraction, which contribute to 75 of tocotrienol and 25 tocopherol. This structure of tocotrienol has the phenolic group, which is able to combat against oxidative stress. The tocotrienol, which contribute to the most of TRF proportion, has superior antioxidant compared to tocopherol, and it has been proven to provide anti-angiogenic property in previous studies. Moving on to the methodology, by using oral route of TRF administration, I divide into three groups of rats, which are N, the control rat, DV, the diabetic rats, and DT, diabetic rat treated with TRF. And they were further assessed by fundus imaging, retinal angiogenic genes, and retinal angiogenic proteins. We proceed with the result. In this graph, normal rat showed a constant increase in every weeks of treatment period, but diabetic showed slow weight gain. Interestingly, TRF revealed a significant increment of weight gain from week 9 until week 12, which could be due to improvement on body metabolic activities. For blood glucose, normal rats maintain around 7 to 9 millimole of glucose, whereby DV rats indicate a constantly high blood glucose throughout the period. In DT, RBG reveal a lowering of blood glucose as early as week 4, which could be due to improvement on the uptake of glucose by the body cell, and maybe that is why there is improvement in body weight gain as well by preservation of body metabolism. For the fundus image assessment, we do adjustment first for brightness and contrast, followed by image calibration and selection of the zone near to the optical disc margin, and finally we do the assessment of the diameter. Moving on to the vessel diameter, retinal venous diameter was increased in N, DV, and DT at week 6 and 12. significantly compared to the week 0. Larger retinal venous diameter was observed in DV compared to N at week 6 and 12 significantly. However, smaller retinal venous diameter was observed in DT compared to DV at week 6 and 12. Whereas for retinal arteries, larger diameter was seen in DV and DT at week 6 and 12 compared to corresponding baseline. There were no intergroup differences for the arterial diameter at any point. For the effect of TRF on retinal VEGF protein and gene expression, firstly, for the protein quantification, the VEGF in DT group has been lowered as compared to the DV. This is in line with the gene expression, which showed lowering of angiogenic expression by TRF. This is parallel with the IGF-1 finding, which showed again lowering of angiogenic expression as shown by oral TRF treatment. Next is the discussion. The result that we have seen in blood glucose level is also revealed in previous studies, and TRF that reduces retinal VEGF and IGF-1 is believed to involve in MAPK and AKT signaling, and also associated with oxidative stress. TRF as a potent antioxidant may act by reducing oxidative damage and hence reducing VEGF and IGF-1. And interestingly, the VEGF and IGF-1 genes and protein expression are coherent with the venous diameter. In conclusion, this data provide fundamental knowledge of TRF against angiogenesis that beneficial for future. This is my publication, certificates, photos, and acknowledgement, the supervisors, the grants, and this research institute, and references. Thank you so much.